How many people in the meeting?
26.
Hello, how you guys doing today? My name is Burford-Berry. I am the director of the West Side Heroin Opioid Task Force. I am so glad you're here today on this lovely windy Wednesday, all right? So I would like to start off our meeting with the new people who are in the room with us. So who is new in the room? Please unmute yourself. First of all, raise your hand, unmute yourself, then tell us who you are, right? What organization you're with, what role you have, and what brings you to the meeting. All right, very good. I see Jim.
Good afternoon. Hi, everybody. Jim Dolan from Above and Beyond Family Recovery Center. I am the Director of Veterans Outreach here at Above and Beyond, and glad to be part of the group. Thank you.
Welcome, Jim. All right, is it Yesenia?
Yeah, this is
All
Yesenia.
right. Oh.
Yesenia Cervantes at SUHI, and I am overseeing the workforce development programming for SUHI at Sinai, and I'm excited and happy to be here. Thank you for having me, and thank you, Dr. Barnett, for inviting.
What's this? What's the acronym stand for, Yesenia?
SUHI stands for Sinai Urban Health Institute.
Thank you.
All right.
And we're part of the Sinai Health System.
Okay.
Thank you, Yesenia. Welcome to the room. All right. All right, May.
Hi, everybody. I'm May D'Artes. I work with Yesenia Cervantes at Sinai Urban Health Institute. I'm Learning Development Manager, and one of my main roles is to design behavioral health career pathways for community health workers. So thank you to Dr. Barnett for inviting us as well, and thank you for having us.
All right, Dr. Barnett is really recruiting folks. Yay! All right, Celeste.
Hi, I'm Dr. Celeste McGill. I am the Addiction Studies Social Service Coordinator at Kennedy King College, and I also was invited by Dr. Barnett.
All right, well, welcome to the room, Celeste. All right, anybody else new?
Hello.
Oh, okay.
I'm Jocelyn Wells, and I am with Loretta Hospital Substance Use Disorder Program, and first time on. So thank you guys for having me.
All right, Jocelyn, we've met before, so I'm so glad you're
Somewhere. I know
Yeah.
I met you, but I'm not sure where.
here. At Loretto Hospital.
Oh,
yeah.
at Loretto? Okay. Okay.
So welcome to the meeting. All right.
Thank you. Thank you.
I am Shirley Fields. I am not necessarily new to the team, but I am new to West Side Heroin Task Force, and I'm happy to be here.
All right. Shirley's one of our newest outreach workers. Yay. Welcome, Shirley.
Thank
All
you.
right. Who else is new to the room? Anybody? All right, we will get started because we do have a very important topic we want to deal with today. We had an uptick in overdoses for Mother's Day weekend. And it was a spike, not an uptick, but a spike, right? We notice for Mother's Day, though, every year that there is an uptick. And I was thinking about Mother's Day, right? This is the first Mother's Day I have been without my mom. And the complicated relationship we have with our mothers, right? The social, emotional, and physical relationships that we have with our mom. And that I think we as a task force need to start thinking about our programming before Mother's Day next year of 25, just to say, you know what, this is a complicated issue. And in April, we need to start unpacking that with people who use drugs, with our clients who are in our programs. I was thinking of the song by Tupac, Dear Mama, right? Dear Mama is this great song that talks about a mother who has a drug usage issue, right? And how there's tension between mother and son. And that's what I think it sort of encapsulates like the Black community. For our Gen Xers out there who know that song, right? If you don't know it, I just tell you, download it and listen to it, right? Because it talks about that complicated relationship. So I think we who work with people of color really need to really understand the dynamics of motherhood and Mother's Day and the messiness of the relationship we have with our mothers, and so that we can start addressing sooner rather than afterwards. Because right now we're doing something sort of reactive instead of proactive. And I want us to start thinking about our programming with our people of color. Like, let's be proactive, especially when it comes to Mother's Day. And like I said, the data always shows. If you can mute for those who are on, thank you, I appreciate it. So with that being said, I am going to turn it over to Dr. Jenny, and she's going to share the information regarding the spike in overdoses we had. And then we're going to talk to Dr. Barnett, who's going to talk about our response to this issue. So, all right, thank you. I'm going to turn it over to Dr. Jenny.
Thank you. And so glad to see all of you. So glad to see Dr. Barnett and all of our wonderful partners to help us. You know, we're not alone in dealing with the serious crisis, but we do need all hands on deck. So I do have some slides that I would like us to go through. You know, some of you have probably seen these slides. This is just a map of the opioid overdose EMS responses from May 10th to the 15th. There were a total of 200.
Ooh, Dr.
Yes.
Jenny, we don't see the slides.
Okay.
Did we give her co-host?
Okay, I might have just I didn't click share. All right. There we go. Do you see the slides now? Yeah, okay. So we saw a total of 242 overdose EMS responses between May 10th and the 15th. These are some of the locations shown on the map. Over this period, around 50% of all these overdoses occurred in the 5 West Side neighborhoods. So Austin, East West Garfield Park, Humboldt Park, and North Glendale. And well, actually, we have confirmed that multiple samples of drugs associated with overdoses during that weekend tested positive for very elevated levels of medetomidine. So on Monday of this week, we sent out a health alert around medetomidine newly in Chicago's drug supply. This is just, you know, you can go on chicagohan.org to access this document. But in addition to medetomidine, these same samples also tested positive for fentanyl or heroin. It was one or the other. But also xylazine, alprazolam, and some nitazines have been detected in these same samples. It is a new adulterant in Chicago's drug supply. It's a non-opioid sedative like xylazine, but considered more potent with no approved use in humans. However, a related compound, dexmedetomidine, is sold as Precedex or Dextor, and it's actually medication that our anesthesiologist colleagues and intensive care doctors are familiar with because it is used as an anesthesia drug or to sedate patients, for instance, if they have to be intubated. So there is some medical experience with this drug, so that's a good thing, right? It's not so brand new to medicine. However, in terms of intoxication, these people presented with very, very high levels in their system. So, you know, we are taking these cases very seriously. All overdoses with features such as low heart rate, prolonged period of low blood pressure are being reported to the Illinois Poison Center, or recommending them for report to the Illinois Poison Center. We can also coordinate with you if you report to 311 for drug testing. And we're recommending that all patients whose overdose was reversed with naloxone to be started on buprenorphine and methadone before they depart the ED. So just a quick overview of how quickly medetomidine has sort of spread in the US drug supply. So it was only sort of first detected in Maryland in late 22, and then it sort of made its way to Canada earlier this year. And then in April, it popped up in Philadelphia's drug supply, and then Pittsburgh, and then by May, so it probably around the same time entered Chicago as it entered Philadelphia and Pittsburgh. And you know, like Pastor Fania was alluding to, every summer we see this spike, right? So this is data on EMS responses related to opioid overdose over the past 3 summers. And you see that there's a peak right around June, July, 23, and might have peaked around May, June. So this year, I don't know if we're also peaking May, June, or if we might see another peak in July. So we're not surprised, but you know, something that I also want to point out is that the peaks have been lower over the years, right? So I don't know if you all follow the news this week of how the national trend in opioid-related overdose started to decline for the first time in many years. And we actually saw a similar trend in Chicago. And although it has not continued to increase, right, the decline has been small but notable. Nevertheless, the number of deaths due to opioid overdoses continue to be historically high compared to before 2020, right? So it's no time to celebrate. It's just to say, how can we evaluate the inroads we have made in overcoming this crisis, and really be diligent about next steps. So our commissioner has made a point to City Council that we do have a summer target. Our goal is that in all 5 West Side neighborhoods, every household should have Narcan, and every person should be aware of MARNOW, the hotline for accessing medications for opioid use disorder that is free to all Illinois adults. And our summer strategy is 3-pronged. We, of course, want to distribute Narcan, encourage drug checking, and weave that with overdose education as well as connection to treatment. So how do we best share Narcan information related services to the folks that we love and hold dear? So insofar as this insofar as the response related to the spikes in overdose since 2 weekends ago, we will be continuing to have a weekly sit rep on Fridays at 11 a.m. So if you would like to be added to that meeting, let us know in the chat. This past weekend have been quiet, but I think we certainly want to preempt that there might be a spike over Memorial Day weekend. So I think next week we will continue this cadence at least. And I think we are in the process of forming these working groups. So this meeting is really, I'm hoping to sort of galvanize some discussion, but as well as tangible next action steps around street outreach and sobering services. I know that the state has, as well as the West Side Task Force, has been coordinating event this Friday, and I'm sure Dr. Barnett will be able to cue us in on some of those details. But I think it's time for us to kind of assess what resources we have, what we need, and how we can all contribute to making sure that whether it's test strips, supplies, staffing, human resources, material resources, that we can get those all deployed to the most necessary areas of the city. And then we do have a hospital coordination call, ED hospital coordination call with our FQHC partners in terms of strategizing outreach for our most heavily impacted hospitals this Thursday, so tomorrow at 2 p.m. in the afternoon. So if you want to be on that call as well, let me know. You can email me, I'll put my email in the chat. And I think I will just pause here, and I would love for the rest of my time to encourage, discussion and maybe coming up with some concrete next steps.
B, is there, oh, I see Chelsea. And B, if you can monitor the chat for me, I appreciate it. Thank you.
Hi, Dr. Hua. Thank you. I wanted to ask a couple questions. First question, just learning as I continue to learn, as we all continue to learn about the cultural implications of what this means. I guess one thing I'm wondering is, you have a lot of older Black people dying, and what kind of strategies can we incorporate to make sure that we're matching the response with that community? The other thing that I'm hearing from my colleagues, some of them who are here, is that this is really traumatizing for them. This is really traumatizing to continue to see people that you care about and people that you're even meeting for the first time. I had a colleague reach out to me yesterday saying 7 people overdosed in a bathroom or in a basement, and I'm witnessing all of them in front of me right now in the ER. What kind of support can we also include for our providers who are witnessing this every single day? Because we're going to burn them out and we're not going to have enough to replace them. So.
Gosh, yeah, I mean, thank you for asking those tough questions. I don't have the answer, to be honest. I think from a public health perspective, right, we always say prevention is, for the problem to be so out of people's minds, right, because they vaccinate and no one sees measles and now they deny the existence of measles, right? Like, if only we can get to that point with opioids. And so in terms of what I'm hoping that we can achieve is over the summer, and this is going to be a long struggle, is that we get more people on medications, right, on buprenorphine in particular, because that prevents that overdose potentially from happening in the first place. And I know some of you here are doing amazing work on that front, because every time someone overdoses and you go through that whole transport process and they're in the ED, and these are not fun places to be, right? Just because you didn't die doesn't mean that you weren't horribly traumatized. And, ED personnel, doctors, medical workers, they shouldn't have to be subjected to this. And I can go on and on and on about the systemic reasons why this is what we are dealing with. I mean, there are some very important systemic reasons for why this is happening that require some really prolonged advocacy to change. But what can we do in the next days, weeks to months? I think, we really need to solidify this hospital-based coordination piece. And that's why I'm hoping that, we as a city health department are also not the most powerful players in the room, right, to be honest. But what we can do is we can coordinate, right? We can help the partners that we do fund to access emergency funding if that's what's needed. And for many of these partners that are FQHCs, OTPs, to maybe make that connection with hospitals that are struggling and be there for warm handoffs. I'm hoping that Dr. Sorrell, who I don't know if she's on this call, and Dr. Sophia Pang, that they're working together in creating a program across EDs in the city that utilizes warm handoffs, right? Maybe through peer navigators, to start everybody on BUP before discharge, right? So for opioid overdose, so before discharge. So California apparently has this program in every single EDs, and it's a service available 24/7. Why can't we have it? So we need to learn a lot more about how to implement that. There's a lot of work to do there, but I'm sort of a strategy, operations, implementation type of person. So for me, the burnout issue has to do with systemic change fundamentally. I'm not going to say like we can offer you more wellness breaks or anything like that, right? So what we need to do is to change the system. But yeah, I mean, I thank you for bringing that issue to light.
Thank you. Anybody have any more questions for Dr. Hua? And going back to Chelsea's question, I had a radical thought regarding older Black men. Like, our team comprises of a lot of older Black men. And I think it's helpful and with them is that to honestly employ them in work of outreach, could be something we could do, right? Our work does not require abstinence recovery. That's not what the task force is all about. We just we want people who work in the task force to make connection with other people who use drugs. And so I definitely always thinking of funding, right? Like, I want to employ anybody who wants to do this work, especially outreach work. And I think older Black men can work with older Black men, and they can help each other make connections to their usage, right? As well as if they desire abstinence-based recovery. Please let this be a dialogue. If you have questions, thoughts, concerns, pushback, it's okay. This is space for that. Anything in the chat, B?
You know what? We did have something funny. I was cruising for it, but I lost it. But I just found it. It looks to be from CRA. What are we doing for the folks that have OD risk potential and are either uninterested in treatment or don't have an SUD diagnosis? I believe that question was just for our last speaker from CRA.
For someone who is at risk but do not have substance use diagnosis.
Correct.
Well,
yep.
So can you elaborate on what kind of resources do you envision?
Does CRA want to come on camera?
Yeah, this is my question. Can everyone hear me?
Hey, John. Of course.
Hey, everybody.
Can hear
Hey.
you.
Yeah, so overwhelmingly, the folks that engaged organizations like CRA, and I can speak for at least our population, I mean, we have, tens of thousands of encounters, and most of those folks are not engaged in treatment. They're not interested in treatment, or they don't qualify because they're either recreational users or they don't meet the clinical definition of having a substance use disorder. But that also, doesn't mean that they don't have overdose risk potential. So I'm not in any way trying to, criticize or critique, increasing efforts and access to things like buprenorphine. But, one of my frustrations in these moments is that we prioritize that. But I mean, we have, again, thousands of participants who are just not interested in that type of access or resource. So, and they are dying. So, what else can we think of as a coalition and as a group of folks that can help that population?
Well, so I think there are some resources, but I will let, I don't want to speak too much because I can go on and on. Maybe Lee and then Ruchi.
Yeah, I just want to, in some ways you need to go where the preponderance of older adults are, and there's a lot of senior CHA homes, and of course all that work with the churches, ever increasing work. I mean, a lot of older adults go to the churches are kind of like the prime kind congregation. So I think one of the things is just where are folks, and what kind of information is good for them, as well as the street work and getting older adults out there working. So
Right. So I went to a safe haven today on California and Roosevelt and did training around harm reduction and MAR now access, and got some really interesting responses. And so far as we have not heard of this before. I mean, not to call them out, they're doing great work, but I just want to say that, if we could create a list of institutions that we can go round and around just to make the message stick, right? Because these are large organizations. They have hundreds, if not thousands, of employees. So I think, one opportunity for this working group is to come up with a list and prioritize that list and figure out how we can do some very active engagement and outreach, including going on site if necessary. So appreciate that suggestion, Lee. And again, I'm hoping for some action points. If someone wants to volunteer to make that list, feel free to raise your hand or put your name in the chat. Ruchi?
Yeah, so, I think everyone knows I work for PCC, and, I also have my position at Rush, but the reason I work for PCC is because we have a large outpatient, and then we also have our inpatient service that we provide to West Suburban. We predominantly serve the Austin community, and the Austin community has traditionally had the highest rates of overdose fatalities. And we have, older African Americans who have that age-adjusted fatality rate from opioids, right? So they are basically like that priority population from a public health perspective. And sadly, this particular overdose outbreak from the data crunch has affected this population. And they are also, when we look at whether they report their demographics as also experiencing homelessness, right, or unstable housing, or they're literally like unsheltered. So when we spoke with the ones that we have been serving at the West Suburban site, which is a very under-resourced facility, I'll just clarify, they do meet criteria for substance use disorder. Many have been using for a very long period of time and do express that they would like to have treatment. So I can only just express that this population has been overlooked for a very long period of time. And because of their other social determinants of health, they've been incarcerated in the past, all of these different aspects, I will continue to advocate for this particular population to receive services which are difficult to get. And, oftentimes because of where they're living, they don't traditionally access all of the array of harm reduction services that somebody who is a recreational drug user might access, like, syringe exchange, drug checking, test strips, for a number of reasons. Often it's fear of arrest. They don't trust the person offering the services. They may have mobility issues. They have transportation issues. They might just be looking for food or shelter for the night. Those are all of the things that they have reported to us that they don't. So I do think that what the city of Chicago has already done has put out those RFPs for community drug checking. Those are great. We've looked at that guidance from Toronto. They were the ones who first identified this contaminant in their drug supply, and how they really amplified that out. If that could be offered to this community, I think that would be wonderful. However, I think we're a very long way from building that bridge with this particular population from what we've asked of them. So I think that's why we promote treatment for this population. They are older. Their blood pressure is 225. They're having aortic dissections. They're having strokes. They're having brain bleeds. They may never recover from this. I mean, it's really sad. So I am just here to talk about this particular population. I think it's great to get the information out to each and every person who may be purchasing substances right now. We've already sent this information to SUPR. We've asked to have it out to everyone who accesses a methadone clinic. Anyone who might need it, it should be sent out to the schools. I mean, IDPH just put out the alert, but everyone should have access to accurate information. And I think we all need to be working together on this. I mean, that's really people will trust the information from who they actually trust, but it's in the supply. And I think we need to really like get the information out to people. They're very receptive to receiving it right now. I think a lot of people don't want to be exposed to this, but there may be some people who are okay with it, and they like the effect of the substance in a small amount. So
Thank you, Dr. Rushi, for sharing. Do you have any comments, questions for Dr. Rushi before we go to Willie Davis? Willie.
Good evening, everyone. My name is Willie Davis, and I'm with the WE organization. And we're an organization here on the south side of Chicago in the Roseland, Pullman, and West Pullman community. And basically, we do overdose prevention. We are a boots on the ground organization. And the Roseland, the Pullman, and the West Pullman has a high rate of overdoses. And the work that we do, it could be more done. But like you were saying, that the funding, we do not have the funding. And the funding that we do get, we are able to hire one outreach worker for like he'll work 2 hours a week. And we're able to pay him $100 because that comes out of the grant, which lasts for 6 months. So we're able to pay him for the 6 months around $2,500. But work is getting done. And these are individuals that once was out there on the street themselves using drugs, so they know majority of the community. I got a call yesterday from one of the individuals that I met on the street. And she was telling me, man, she came downstairs.
Willie, we've lost you, but we
Yes. And she found her son. Hello, can you hear me now?
Okay, yes.
Hello?
Go ahead. Keep on
Can you
speaking.
hear me now?
Yes.
It was just one situation where one of the clients that I was serving, she was telling me yesterday, she came downstairs and she found her brother laying on the floor. He was overdosing. So she ran upstairs, got the Narcan, administered Narcan, and it brought him back. But at the same time, she wanted to know, is there any other way that she can assist her brother? And we talked about it, and I talked about the different programs that are available for her. But get to the point that if our organization had more funding, we could do more work. But because we have less funding, we can't do as much work as we would like to do here in the Roseland, Pullman, and West Pullman area. We have a resource fair coming up on June the 8th at the West Pullman Park. And we would like everybody to come out. If anybody interested in coming out, you can reach us at weorganization612 gmail.com. I'll put it in the chat box.
Thank you, Willie. Appreciate the work that you're doing. We're gonna call on Kate now.
Thank you. My name is Kate Reed with the Overdose Response Strategy, and I love these questions so much. It's just so encouraging. Just the intentionality in your group. I think just wanted to share just another idea that another county is using. So I grew up in Kenya and East Africa. So this is a model that's being very effective in Zimbabwe. And it's called the Friendship Bench. And so they train grandmothers in this model just to respond to the mental health needs that, if left unaddressed, can then eventually lead to substance use disorders, to cope, and then overdose. So what they do, they just train lay people to respond to mental health needs. And so that's what we're doing in Kankakee County. We're just training people with lived and living experience just to respond to mental health needs. We're using emotional first aid, which is available for free online, these trainings. And then they're taking it to their sphere of influence, just like she said, just the importance of stewarding that trust where it's already built. So the barbershops are using it with their people where they are already earned that trust, and the athletes are using it with their trust, and the churches are using it with their trust. They're just stewarding it that way to just get it out to people on the front lines, instead of making it be clinical, where there's all the stigma and people feel they're not equipped to respond. And we're having a summit in October for Red Ribbon Week, where we'll be offering these trainings for free for anyone across Illinois. So we'll send out more flyers for the next meeting for that.
Thank you. Actually, there was one of the ideas a long time ago that Lou and I were thinking about, this friendship bench, right? Investment in peer workforce is basically what we're talking about. People who are the same age talking to each other, maybe even older, younger, talking to each other, connecting, right? That's what you're talking about. In Zimbabwe, we had looked at that too, because the West Side is highly relational as well as the South Side. And clinical settings are okay, but that's not what needs to happen in our communities to deal with the issue. Anybody else? V, is there anything in the chat?
Maybe I'll just respond to the question that CRA raised, which is, I do understand that there are different people using drugs and their risk profiles are different. Their avenues of use are different. And I, also fully stand behind what Dr. Fitzgerald said, that Black men, and what our data in particular shows is that Black men and between the ages of 45 and 65 are at the most risk. These are the people that we see ending up in the medical examiner's data as mortalities, as fatalities, right? So, so from a public health perspective, our commissioner is committed to doing everything she possibly can to address this, the disparities of this crisis. But yes, I also understand that substances are a part of our world. People may use it without substance use diagnosis, and I think drug checking, in the is a really important community resource, right? And I think drug checking is a resource for both people who with substance use disorder and people who do not have substance use disorder. And I am curious as to what recommendations you have of making this resource more widely available. And like for instance, Baltimore has an anonymous alert system for bad batches, right? I don't know if there are similar systems in place in Chicago. So this is also something that I'm happy to explore.
I just want to be clear too, like the disparity in people of color is not a new phenomenon, right? Like this has been a product of the drug war and the disinvestment by the system since forever, right? So we have plenty of data that shows that people of color and men of color in particular are disproportionately impacted and have the worst health outcomes, including death. So that's not new. My issue is that we, in these conversations, we prioritize, for a very large portion of the population that uses drugs, modalities that they are not interested in engaging. So I get frustrated because we, CRA, and somebody said this earlier, the trauma of going out there and working with the populations that we do and seeing such marginalization, such death all the time, and we're screaming for different investment in modalities like the social determinants of health, like Dr. Fitzgerald discussed. We've been asking that for 30 years. So I apologize if my tone is a little frustrated, but we desperately need new interventions and new ways of looking at this crisis. And by uplifting the same ones over and over again, we're not making any progress, at least in my perspective. So I think I'm going on a rant, but I'll leave it there for now.
I want to actually say something hopeful in this moment, John, right? John, CRA started this work, right, of harm reduction, of what we're doing now, right? And now the task force is convening and addressing these issues. And people of color are more in the conversation now. So things are swinging, right? Shifting a little bit. So just so you know, we're here. We're going to figure this out together, right? We're going to work together and figure this out. And we're going to think of different modalities and I just want everybody to be safe. All of us just want everybody to be safe and stay alive, right? And that is what we're working towards. So, yeah, just we'll work together, John. We got it. All right, Dee Dee and Chelsea. And then after that, we have to close up and move to the next piece of our conversation, which is another, our response, right? So.
Hi, good evening. Thank you. Good evening, good morning, good afternoon, good something. Hello, everybody. I just wanted to share that in terms of getting more people involved, I think, being an ordained minister myself, we need to get, especially in the people of color community, mainly the African American, we need to get more of our churches involved. I know one of the things that we're making sure at my church on the South Side, that the health professionals, as well as our team that works, with provide substance abuse meetings and things of that nature, we need to make sure everybody's trained in using Narcan. But the other thing, we need to have a safe space in the church so that these people will feel comfortable coming in to talk about their issues and their needs, because there's a whole lot of disparities in our community. It's not just drugs, it's education, it's a whole lot of stuff. So we cannot just not address those other needs that are pending and just look at the drug issues, because those are some of the reasons why we have the drug issues to begin with. The other thing quickly I wanted to share was, God, I'm getting old because I just lost my train of thought, but it's really, really, we can't just look at, because most of our congregants, they're going to have loved ones that are on drugs in their home using drugs. And we have to look at those that are using prescribed medication, because that's another problem. The children are getting the pills, the mothers are popping the pills. So, it's a lot to unpack. But I think, as far as I'm concerned, because I've been going into the prisons for over 30 years, we really need to get the churches in the community more involved. Just open on Sunday for 2 or 3 hours doesn't work for me. And if that means, knocking on doors, sending out letters, whatever it's going to take to get them to see, because you can't act like you don't see the elephant in the room. If your congregants are not hooked on drugs, their family members are. So I just, wanted to share that with the team.
Thank you,
And
Reverend.
I agree with Lee in saying that it's just not Mother's Day, because I'm also at women's, I always want to say women's treatment. I hate to close women's treatment. Haymarket and Grace House. Around holidays, Memorial Day weekend, 4th of July weekend, that's a trigger.
Yes.
And that's when you're going to see a spike. So we need to, like you said, be proactive and talk about it. How you feeling? How you processing prior to, afterwards? Oh, I went on a relapse and got high. Well, why did you get high? Because I miss my mother. I miss my children. So we need to start talking about how do you celebrate sober?
Yes.
How do you celebrate being away from them in treatment centers? Let's talk about having a party up in here and celebrating them. So God bless you.
Thank you. Thank you, Minister.
You're
Didi.
welcome.
Hey, Chelsea.
Okay, I promise I'm going to be super quick. Okay, y'all, you guys have this collaboration, the amount of powerful advocates and groups in this one coalition meeting right now is really amazing. It's a gift. And we all know that we are not going to get out of this by talking in our echo chambers and arguing, because I think we're all trying to say the same thing and figure out how to offer resources. But what I will say, running the Harm Reduction and Recovery Coalition, which is looking at the state and federal government's role in all of this. And Jenny, this is something that you and I can talk about 8 million times if you want. The IDPH budget for February, that came out in February from the governor for overdose prevention, was $1.625 million. $1.625 million is the entire Live for Lolly budget for the year. In the middle of an opioid overdose crisis, our state is only willing to invest $1.625 million into the response efforts. I just want to say that to you because it's not a secret. It's a public document. Anybody can go and look at it. But one of the things that I think, in addition to figuring out how we can all rally behind the outreach that I'm hearing, and obviously these suggestions are like so crucial and important, is how can we all work together also to mandate, to ask for more from our own government, who is saying they want to address this and save lives, because Jenny's going to be stuck between a rock and a hard place if IDPH isn't able to get her the funds that she needs, just like every other health department is. So I just wanted to say that, and Fania, extend like the offer, like how can we help from like a state and like macro level perspective of getting the resources that are needed on the ground when, where, and how we can. That's all I wanted to say, because we have to do all of these things at the same time.
Chelsea, I think we need to create a subgroup, and we'll work together to figure this piece out, because I do agree with what you're saying. And a lot of folks on this call were shaking their hands saying yes. So let's get something together. Dr. Hua, thank you. Do you want any final comments from you?
No, I just wanted to elevate, you know, if you want to be part of the conversation around hospital ED coordination tomorrow, let me know. And look forward to action steps. I think Dr. Barnett's presentation might present some, so.
All right. We're fully on board on getting Narcan in everybody's home on the west side. And I know Southside Task Force is on this call too. I think they're fully invested to do the same thing. So let us continue with Dr. Barnett.
All right, blessings, everybody. I am Donell Barnett. For those that don't know me, I serve as the behavioral health advisor to Director Garcia at SUPR, IDHS SUPR. One of the programs that I oversee is the Westside Task Force, and so we've been working closely together on this and a range of other items. I wanted to, before I begin, just want to say thank you to Dr. McGill and the folks at SUI. I invited them for a couple of reasons. One, because they both have a lot of work in the behavioral health workforce pipeline with community health workers and CADC folks, and also to see if we can create more partnerships in this work that we're doing together in community. So I'll jump to the specific point. Once, as we have been discussing, we are aware of the alert, the rise, and we are monitoring that and gearing up for a response. This weekend, Memorial Day weekend, in addition to the spike in opioid overdoses, it also coincides with one of the deadliest weekends of the year from a gun violence prevention perspective. And it also, so because of that confluence, along with homeless issues, I have worked with our Office of Firearm Violence Prevention and our Office of Homeless Prevention to coordinate a massive, or as massive as we can get it, outreach event for this Friday. So what I'm going to talk through is a little bit about what we're planning to get that information out, and a little bit of discussion of how everyone can play a role and get involved. So what we are hoping, broadly, what we're hoping to accomplish is to get the information out to the community, as was discussed earlier, that loved ones who have family members who are affected by this rise and other substance use concerns, churches, community organizations, businesses, folks that are in the community that see this, that experience it, that it's a part of their day-to-day life, that we we continue to and strengthen the connections that we have, providing them with the information in terms of making them aware of some of the additional problems, and making them aware of the resources that's available to them. This isn't work that's different from what the task force already does. And so the task force has graciously agreed to take the lead on this, and really helping all of us as a community mobilize and respond, even if in a small way, to get the community more engaged in this recovery process. So this Friday, we will convene at the task force building on Lake Street. We will be there. The entire event will be from about 11 to 2:15. We will begin with a briefing from our partners at the city, who will give us some version of what Dr. Watt presented earlier, to help those who are new to this information understand the seriousness and some of the key issues that's going on. From there, we will disseminate sort of the key messages. We really want to give everybody some basic level of training that as they go out in teams, they have very specific messages and talking points that they can focus on as they knock on doors, as they engage people, that they'll have that information right at the ready. And so we'll spend some time getting people briefed on the information to put out as they are going on their outreach teams. After we do that, then we will spend about an hour and a half breaking out into teams, divvying up different sections of the West Side, and folks will begin to go out and do that outreach. We'll come back following that outreach period and then have a debrief, and then we will close the event at that point. This is, we have engaged our partners with OFVP, Office of Firearm Violence Prevention, and Homeless Prevention, because they also have some version of street outreach in their respective disciplines as well. And it's my belief, my firm belief, that we are better together, since we are talking about many of the areas with these overlapping concerns, these overlapping social determinants, if you will. Then it makes more sense that we align ourselves and partner as much as possible to save as many lives as we can going into this weekend, which we know historically has a lot of tragedy. We will put out later today, we will put out a sign up link. I would encourage you all that are on the call to fill it out and to share it with your networks. What we would like to do is start to build a list of those who can volunteer that amount of time on Friday to go out in teams, so we know who's coming into the space, what organizations you represent, and we can start to have some accountability from that perspective. So I'll put that, or Fania, if you wouldn't mind, just throwing that link in the chat. You can go ahead and start filling it out and sharing it with your networks. And we will also make other resources. People will have physical flyers with them that will list, here are your talking points, here are your resources, so we can establish that baseline level of prevention. That is the main points that I wanted to cover for today as a part of this effort of responding. And I just wanted to respond to a comment that was made earlier. Our response at IDPH is sort of one part of the overall response. Response happens in a lot of different ways and in a lot of different communities. And I'm grateful again for the work that the task force does as a part of our work and our effort. Pending your questions, that concludes just what I wanted to put out, just to kind of take a few minutes of your time, and again to express my extreme gratitude to all of you for the work that you do in the sectors of your life that you do it. We know that is not just hard work, it is also heart work. So thank you so much.
Thank you, Dr. Barnett. Anybody have any questions, comments?
This is Brother Andre from Circle Urban Ministries. Are you able to send that email out about the meeting on this coming Friday? Can you send that email blast out to us regarding what he just said?
I will send the email out, CC, with the link to the to volunteer, yes, or to work that day, that Friday.
Oh,
absolutely.
okay.
Minister Andre.
And if I could just say, if you are affiliated with Greek organizations, with faith organizations, with other community organizations that you think They have folks who would want to come out and partner with us. We want to blanket as much of our community as we can.
Thank you.
Beautiful.
Are there any comments in the chat, V? Oh, I see. Oh, hey there, Dr. Regina. How you doing?
I see a
I'm
few. Go
blessed.
ahead, Dr. Gina.
I'm blessed today. I really enjoyed all the comments. I really enjoyed the effort that you guys are doing. One of the main topics and one of the main resources while we're out there is housing. You could provide all of these services. I've been doing housing for 32 years. Each sector, it is just, thank God you guys came up with harm reduction because the certain population cannot get recovery by mixing them together. So that's one of the main issues. You cannot take a homeless person and expect for them to get their lives together if they're homeless and they still out there in the struggle. So I have done an expansion of Ashanti and try to do expansion because you need different levels of housing in order to help these people. If you want them to get off these drugs, you first got to put a roof over their head. Then you came up with, I thank God you guys came up with the harm reduction. I studied it. The people, the MISA clients, which we have out here. Some of them that's on this fentanyl, all these pills, they're MISA, they're substance abuse or mental illness. The system have really recognized that, and everybody's coming up with prevention. The first prevention I know, and since I've been doing it 32 years of my own housing and have different structure of housing, is that the only way that I can help them if I can stabilize them. So when we go out Friday, I believe it's just not treatment. From treatment, they need recovery. It's certain levels, and I believe while we out here, we need to offer that homeless person where he can go. And then we can help him. If we can stop him from doing, and with harm reduction, if you're doing 10 a day, if I can get you down to 5 or 6, we're doing good. In the household, the family really done kicked them out because they're disturbing the household. So they're in the streets now. We can knock on these doors. The mom done put the kid out, to put the family out, to put the husband out and everything because they own this. So we need to come up with solutions how we can help that population. And it's just not people of color now. I am in the crutches. It's people of all walks of life that is experiencing this. So we need, as a collaboration together, come up with that solution by itself. And then all the rest of it, the prevention, the opiate task for prevention, all that, then you guys will be even more effective in what you're talking about and what you're doing. It's just my opinion for me being doing this for over years and trying to expand with these different housing and components. I can't miss a person that's on cocaine it does not have a mental illness with a person that does. So I think that is the first thing, you guys, we need to talk about, and everything else will work. And that's just my opinion and also my experience of being out here and dealing with the people.
Thank you.
Some I can't house because of that. And thank you guys for listening. I thank you for the collaboration. And Tanya, I'm a big collaborator.
I know.
So thank you.
Thank you. I appreciate it. All right. Do we have anybody else? Because we got to move on. We got some reports to make from the team. Okay, perfect. All right. Street outreach team, Luther Size, what do you have to report? Yes.
Fania, you know what? I would like to relinquish my time to some of the other guests because we give our report every month. And you all really gave a good information on what we're planning to do. So let's move on to some of your other reports that I would like to hear and maybe other people would like to hear. Thank you.
All right, thank you, Lou. Appreciate it. All right, we have Sheila and Tom from our Narcan on the CTA group.
Sheila, if
Yeah.
you can go ahead.
Okay, thanks. And just thanks to everybody who I've been listening in and just blown away by just the level of passion and expertise and commitment. It's just, this is such an inspiring group. I just want to thank you all. This is our update from the Narcan CTA work group. The subcommittee is in an active progress state, working with a few different stakeholders with mutual goals. Cook County Health legal team is working with the CTA's legal team to finalize their partnership agreement on placing Narcan machines at CTA stops in the city of Chicago. CCH, and I'll just warn you, the acronyms here can get a little, it's an alphabet soup, but just know the overall direction is positive. CCH is also finalizing their budget with the Chicago Recovery Alliance to provide restocking services for 6 of the 8 machines. CRA is also working with Cook County Department of Public Health on a contract for restocking the remaining 2 machines, which are located at the suburban stations. We have 2 Cook County players here, Cook County Health and Cook County Department of Public Health. Both are wonderful, but I know it took me a minute to get the difference. So they are finalizing a budget for that work. It should take 5 to 7 weeks for the agreement to be signed by all parties. In terms of timing, all of this is dependent on getting legal agreements together and leadership signing off. So we don't have an exact time when the pilot can launch, but hopefully by the end of the summer. So again, the pilot here, for anyone new to the conversation, is getting Narcan machines either on train platforms or as close to train platforms as we can. And we've just been really blown away by the commitment from the CTA, CCH, Cook County Health, and Cook County Department of Public Health, and the City of Chicago Department of Public Health, which of course was the pioneer in this area. So I will stop and have Tom add in anything I overlooked.
I don't think you overlooked anything, but and I think I reiterate this all the time. This is one of the glorious things about this task force is that, you know, our department just started as an idea that we thought might help more people in the future. And then, you know, you people came together and we've got a ton of people that are partnering with like our subcommittee, and it is becoming a reality. Like, so just keep that in mind. I know we get data and there's always people that we want to help, but all the people that are doing the most are literally on this Zoom call. And if you don't think you're doing anything, you're wrong. Like it's coming together. And if you think there's a problem and you don't even know if you've got a solution, just keep coming to the meeting and bringing it up, and you know, somebody's going to try to help you. So keep that in mind.
Thanks, Tom. Any questions from the group about the Narcan on the CTA work group? Look in the chat too.
I have one question, and my question is, I understand that it's on the south side. We were approached by Forest Park Police and CDPH in reference to assisting the night ministry with handing out Narcan and fentanyl test strips. There's a big issue at the end of the line in Forest Park.
Mm-hmm.
So my question is there any plan to extend it further west?
Yes. So the stations that are part of this pilot are located all over. They were very intentional in getting them south, north, west. And I know at Forest Park, we're aware of the night ministry because they have that table set up. I don't have the proposal in front of me, but I'm like very 99% sure that there might be a Narcan machine, and Tom can chime in. I will check the facts on this and we can put it out to the group afterwards. But I hear you about Forest Park having a big issue. I live in Oak Park, and I'm very familiar with the Forest Park end of the line and the great work the night ministry is doing there. Also Harlem, we want to get those end of the line stops because we all know that's often where people are discovered who might be in, fatal overdose.
Yeah, Dora, it's a great question, and I don't have the proposal in front of me either, so I forget exactly how far west. But we're not even sure all of the proposed locations are going to get the machines yet. That's part of what they got to finalize. But we also actively know that this is our foot in the door, at least in this, kind of area and we're hoping that once this gets finalized, then we can start to expand from there. So that's all the locations are spread out fairly well across the city. But the really good thing is that Cook County is involved and most of their work is suburb. So, like I think Sophia's on this right now. Like initially when she was working with us, she had some CTA Narcan boxes that were going to be used in the suburbs. So even with the things that we're doing right now, we have people that are actively thinking about the suburbs and the L stops that are there as well. So it might not be right away. It might be the kind of the second or third step.
Thank you. Does anybody else have any questions for Sheila and Tom's? All right, thank you. You guys are doing great work. I'm so excited. I can't see the rollout is going to happen this summer. Yes, with all these venues.
And we can't do it without the our fearless leader, Fania, who is there putting together the calls, getting us to do. So props to you, my friend.
Thank you, Sheila. All right, let us move on to the housing work group. Miss Mary. Oh, Miss Mary, we can't hear you.
Okay. Thanks, Sonia. I'm taking Tim's place today, Tim Divitt's place, who's the co-chairperson of the housing work group of the task force. And at our last meeting, we had invited, and she came, Emily Piper, who is the Residential Recovery Services Coordinator of the Illinois Department of Human Services. And she was there to explain that recovery homes do not need to, there's no rule that says that people cannot go into recovery homes without going into detox. And there would seem to be some confusion at some of our meetings. So it turns out that that's an individual case-by-case thing. The people at the recovery home level make that decision. And that there are people who are using methadone and Suboxone who do not need detox at all because they would be detoxed from the very substance that is medicating them. So that was really good to have her there. And I've also noticed that she's been at a lot of meetings that I've attended since she's been the new coordinator. So that's good. She's getting to know the community. And I'd like to second what Dr. King said, Regina King, about housing being so fundamental, housing first, as we say. And so the housing work group is really dedicated to finding appropriate housing for people at the emergency housing level and the interim housing level, which would be recovery homes, and then the permanent supportive housing. So the other thing is to remind everyone that our next meeting of the work group, the housing work group, will be from let's see, June 3rd, from 11 till 12. The meeting is short, it starts on time, ends on time, and it's very effective. So if any of you would like to come, you can, I'm going to put my name and email in the chat room, and I'll make sure you get an invite. That's it for me.
All
Back
right.
to you, Fania.
Appreciate it. Thank you, Miss Mary. All right. Anybody have any questions, comments? Very good. So we're going to move on to Lee with the fentanyl work group.
Well, I just want to piggyback on what Mary was saying. We just started a group of organizations that are involved in street work cross the continuum of whatever services they provide. And, we have some very active and experienced folks who've been dealing with housing issues for a long time. And we definitely can pull them into, this effort as well. But in terms of the fentanyl work group, I'll just give you a little history. The fentanyl work group really came together. Willie's sharing the screen. Okay. Willie, I'm going to get distracted. My ADHD kicked in. I kind of got confused.
I'm sorry about that, Lee. I messed that up.
All right. Anyway, the fentanyl work group really came because one of the things that happened was Juan Hernandez. They had not tested for fentanyl before. Somebody was definitely under the influence. They used a test strip to check his urine because it's not involved. It's not in part of the CLIA approved urine test package. And sent somebody who they found that they had fentanyl, sent them to medical stabilization. They did not test for fentanyl and turned the person away. And this was an issue that had continued to happen. We found out from our partners that happened to them as well. And so we got SUPR involved. SUPR sent a smart alert out, just basically reminding organizations who do intake and do drug testing before intake that presence of drugs is not the determinant of whether somebody has a substance use disorder or opioid use disorder, and to really adhere to the DSM-5. We also did some outward-facing fact sheets and continued to talk about the new drugs that were added to this. We have not met for a while, and I think the fact that this uptick and what we're finding and the ability to do the drug testing, and the fact that CDPH has now funded 4 different organizations to be doing drug testing in Chicago, that we definitely want to, maybe we can even rename this the drug testing committee, so we can continue to have a direct line of getting information from these drug testing partners. And it could be national partners, it could be state partners, whatever, but then we can amass this to really have a quick way of doing it, and also making sure that the information we're getting when we filter it out to the community is usable and accessible. So stay tuned. I know, Chicago Recovery Alliance has been doing this for quite a long time. Yeah, I'm always going to give you the props. But we also have some new entries into this market, so it may not be up and running, but I think the other piece is we can collectively kind of help guide some of these new organizations in this field, kind of say, this is what we need. How can we, and also how can we help you? How can we get samples to you in a way that doesn't take the samples away from people, but also is usable. So that's my spiel. And it's so great to see this amazing group continue under the great leadership of Fania Burford-Berry.
That's unnecessary. Keep on going. All right. So what we need though from the task force, right? We need somebody to step up to do some co-chairing of that group. Like we have Sheila and Tom doing the co-chairing of the Narcan, and we have Miss Mary and Tim. We need someone to chair this new group that's emerging, because we really do need this. And so I want to turn this over to Dr. Hua. Dr. Hua, what's up?
Yeah, I just wanted to make sure that I heard correct, which is that this is going to be a new group, or is it evolving from a different group? That's my first question. And then I also wanted to say, Lee, thank you for mentioning that we are funding organizations. It's actually 5 organizations that we're funding for drug checking, including Chicago Recovery Alliance. And I also want to second the props. They're doing amazing work, and we could not have found out so quickly about methamphetamine without them. But also, we need to also, yeah, come up with workflows that are not going to burn people out and will be sustainable.
Yes. All right, that's Taylor. He does the, I mean, they do the work. Taylor does the work, you know. So, all right, Lee, did you want to, it would be a change of a name of a group. It's still the same group, but we're changing the name of it. So that's the answer to your question. All right, now it's time for your favorite time of this meeting, member announcements. So if you can raise your hand so we can start making the announcements, because we got about 11 minutes left to go in this meeting. My task force. All right, Allison.
Hi, good afternoon, everyone. I'm sorry, I'm driving right now, so I can't be on camera. I'm Allison. I'm the co-chair of the Illinois Women's Committee, and I dropped the links in the chat already, but we are concluding what has been a really hopefully successful statewide survey on services for people who identify as women in the state of Illinois and how substance use services can be better suited to meet the needs of this population. So I dropped the links in the chat. Our survey is going to be live for about 1 more week, and I would love to get your help in just saturating this survey to as many people as possible who live in Illinois. And if you have any questions, I'll drop my email in the chat as well so we can connect. Thank you.
All right, thank you, Allison. Anybody else? Member announcements.
Hi, everybody. So at Sinai Urban Health Institute, we are in very high need of a therapist or somebody with a similar credential, possibly CADC, medical, to help us design. We're designing a culturally informed substance use intervention career pathway for community health workers. So we're doing very innovative work, and I know we have so much expertise in this room. So if any of you have, you know, some kind of therapy training and background, some kind of credential, and any experience designing trainings, we would be so grateful if you would apply for our contract position. I did put a flyer in the chat box. I'll also add my email address again. So thank you for considering. And if you have a friend or a colleague or something and you're like, oh, they would be so good for that. They're a therapist. They have experience in training. They've created PowerPoints before. If you could send them my way, that would be amazing. And thank you.
Thank you, May. Appreciate it. All right, since we don't have a lot of time this meeting, I'm asking you to get your announcements down to like 30 seconds. All right. And also to just put your information for your event in the chat. All right, Willie. Yes.
Yes, this is Willie again from the We Organization, and our information is in the chat. And we have an event coming up on June the 8th, a community resource fair. We'd like for everyone to come out and share your resources, because the community needs the resources. Let's not say, hey, I'm on the west side, I'm on the south side, east side. Let's come to the south side and share that information, because people from the east side and the west side do come to the south side. So I want everybody to be out there on June 8th. Shoot me an email and I'll send you more information. Thank you.
All right, appreciate it. Thank you. Officer Capers.
Hello, everyone. The 11th district will be having Operation Wake Up today at 5:00 p.m. At Lexington and Albany. If you are able to be a part of it in that area, it's in response to the shootings that recently occurred near Kelman School. Again, Operation Wake Up, 5:00 p.m. We also have the Peace and Prayer March, along with the baseball game for the youth, scheduled June 1st for gun violence awareness. So at 8:00 a.m., we will gather to meet and march with them as they prepare to play baseball and bring peace and prayer, and also support their games. June 1st, 12:00, there's also prayer for the youth at 230 North Colmar. December 28th, in response to the drug activity, there's a pop-up scheduled at Division in Lawndale at 5:00 p.m. thank you all very much for your time and having us to be a part of the meeting.
Thank you, Officer Capers. Please put all that information in the chat. You are always so great to have in the meeting. Appreciate it. All right, Jim.
Sorry about that. Thank you. Really appreciate it. Again, it's great to be here. I just wanted to, it's not an event, but just to put it out there as Director of Veterans Outreach here at Above and Beyond. We're trying to make sure that we can provide the needs for veterans, whether they're enrolled here at Above and Beyond or not. I spent 15 years working with veterans, the last 7 with Illinois Joining Forces, and amassed a huge number of resources that veterans can use for themselves, their families. So if anyone is working with a veteran and you simply want to collaborate, or if you want to reach out to me to see if I have resources, again, whether they're enrolled at Above and Beyond or not is not the issue. If they're a veteran and I can assist them in collaboration with any one of you or your organizations, happy to do so. And I'll put my contact information in the chat again.
Thank you, Jim, and welcome to the task force. Yes, I look forward to working with you. All right, anybody else? Announcements? There's some funding opportunities. Check out the opioid settlement site. If someone could put that information in the chat, I would really appreciate it. Just a link to that, to those funding opportunities that are coming up. Also too, I put in the chat, we're having our Faith Leaders Luncheon on June the 21st at Greater St. John Church. So look for that information. And I think that is all. It looks like we're wrapping up. I want to thank you all for this robust conversation. I particularly want to thank you for your concern and care for African-American gentlemen, older gentlemen. I feel as though sometimes they have been missing from our conversations when we talk about opioid usage. And I'm glad we're taking a turn on this conversation because my family is affected by this. My fathers and my uncles, and we just sort of say they don't matter. And what I'm hearing from you all, they matter. And we're gonna do our best to figure out how to help them just have a healthier relationship with drugs, right? And that's what I am hearing from this conversation, and that makes me hopeful. And I want to thank you for all your hard work. So thank you. All right. We have concluded our meeting. All right. So you guys have a great Memorial Day weekend. We'll send out information for the canvassing event. And so we'll be looking for that. So bye-bye, y'all. Bye.
All right. Have a nice week and rest of the day.
Thanks, Willie. Good to see you, man. Good to see you again, Jim. Good to see you again, Jim.
Leah never retire, Willie.
Buddy.
Bye. Nice to meet you all. Thank you.
I might recline, but not retire.